slide. So, good, nice to see you all, and I'm so glad to be here. My name is Malen, but also pronounced as Malen. At Starbucks I'm usually Molly or Marlene. It's okay, I know who I am. So I'm an occupational therapist and a PhD from Stockholm. And
close the door.
I'm glad to be here. This is my first part of the medical advisory board. It's my first time, so I'm really excited. So we're going to talk about hand exercise, but I thought I would tell you a little bit where I am from. So this is Minneapolis. This is where we are now. This is my hometown. It's called Ekere. You know, with the ring with the dots on it. And it's actually the same island as our English. We're not real neighbors. But I pass his house when I go to work. I also work at the Karolinska Institute and also at the Karolinska University as an occupational therapist. So I thought it's allowed to ask questions whenever you want to louder. Should I put it closer to my mouth? Is it better? Shall I be like that? It's okay. So I thought I would talk about a little bit of hand function and different subsets of myositis. I have also done 2 studies that I would like to present, and also go through an example of a hand exercise program. So feel free to interrupt me. I got some questions yesterday during an exercise session. It was kind of hard to just answer it briefly, so that's why I have an hour now to try and answer them. So, I am an occupational therapist, and the goal of occupational therapy is to maintain your daily activities and have meaningful activities. And to be able to do that, we usually use our hands as tools. So that's why occupational therapists often do hand exercise or focus on hands. It's not that we don't care about the rest of the body, we do, but we don't exercise. So have that in mind. So, we have done studies to see that actually hand function or grip strength is reduced in people with poly and dermatomyositis. That was not really known before. And it was said that it was present in the late phase of the disease, but we have also seen that it's hard at the beginning, even as soon as when you get the diagnosis. We did a study and we could see that the women had approximately 71% of what is normal of the age and gender match controls, and the men had 60% of what is normal. So it seems like the men are worse, but when you compare the men and the women are still weaker than the men because men are supposed to be strong. And we could see that the grip strength was associated to the domestic activities, so it seems like the hand function or the grip strength is affecting daily life and quality of life. So this part is in a study. This one I have not published yet. So I don't know how many of you who were at the New Orleans TMA meeting. I might have met you. I was in the lobby doing data collection. You pressed the muscle strength thing and you were answering a lot of questionnaires. So grateful. So what we can see is that in inclusion body myositis, it is known that the finger flexor has reduced strength, and also the ability to move the fingers can be affected. And we have also seen that the dexterity, the fine motor skills, is also affected in IBM. we could see that the women had approximately 42% of what is normal, and the men had 30%. And also here again, the hand function was associated to daily activities and quality of life. I don't know if you agree. I mean, this is a study. Is this how it is in the real world? Yeah. So, check box on that. So, going back to the polio and dermatomyositis, we thought, well, if they have reduced grip strength, we need to do something about it. So we developed the 12-week hand exercise intervention. We were planning to do a randomized control trial, but then we needed like 80 persons with PM and VM, and well, we didn't have that many, so we made it a pilot study instead. We looked at adherence, how well and how many of the sessions that the patients actually did with the participants. We also wanted to know what they thought about the program, and maybe a little bit of the effect, if we could, we would like to know. So this is a quite busy slide. So we did a lot of measures in the beginning. They did hand exercise 3 times a week for the 12 weeks. And I don't know if you were at the exercise session yesterday, but we were talking about that you need to increase the resistance, or you need to do something that you can meet the progress that you get in your strength. So it's not that easy to know how much force or strength you need to press these dose. So instead, for the ball, instead we increase the repetitions. So for some of the exercises we did 5, and it ended up in 15 in the last 4 weeks, or 10, and it ended up in 30 repetitions on each exercise. So this was the program. I was a PhD student. I wanted to have everything in it. I wanted to exercise everything. And figure out, it's kind of, during having those diaries, or the information we got when the participants came to me to exercise every other week, and otherwise they did it at home. So this is an interesting exercise. So you were supposed to put the dough between this is maybe, I will take the dough. So you're supposed to put the dough between the fingers. And I learned that you should have the fingers flexed as well. So you kind of like that, and then you should press. And I mean, just for my brain, it's really hard to do. And we also have the other one that you're supposed to extend the fingers. Really hard to do, not just for the fingers, not for the strength. So going forward, we just took them away. Because, I mean, it's the strength, it's not your mind you're supposed to exercise in this study. So we just took them away. So we had 11 participants with polio and dermatomyositis. And they were really nice to me. They did almost all of their exercise sessions. I'm very glad. But all of them said that the 30 repetitions were too many, and the program was too time consuming, because they're also going to, Helen Alexandersson exercise. And they're supposed to do all of this exercise, and maybe working as well. So they said it's too time consuming. They suggested maybe 10 to 20 repetitions, and maybe more often. So we could see, well, it was important. So on a group level, we could see some increasement in the left hand. The 3-jaw hinge grip is where you put your index finger, long finger, and thumb together. In the left hand, we could see. But there are also only 11, so we can't really say. And there was some individual improvement, and I could see that those who had a dough that was more resistance had a better it's not that difficult to understand. Of course, if you have more loads, you will gain more muscle. So it seems like the hand exercise is feasible. It were nice to do it for me 3 times a week for an hour. But we need to think about the design of the study. So I mean, can't really, the problem here for me to talking to you is that I have science, which is done by studies, and I have my clinical experience, which has not been tested in an orderly fashion, but I think it's kind of important as well. So we learned from this study that we need to do it in another way. So that's what we have done for the hand intervention for persons with IBM, which is even more rare. So instead of trying to get a randomized controlled trial, we did repetitive measures even before we started the exercise to see, so they would be their control. Every person were their own control. And then we continued to measure every other week when they were exercising, for 12 weeks again, and then they exercise 5 times a week for 12 weeks. Continued measuring. We also, instead of increasing the repetitions, we measured the grip strength. And I don't know if you're familiar with the Borg scale. It's about exertion. So how exhausting is it for you on a scale from 0 to 10? And 10 is very exertive. Or what have you ever made that as a number? Or a 0. And we said, well, maybe 4 or 5 on this scale. You should have a toe or a ball that gives you, like, should be as hard and strenuous as a 4 and a 5. So then, if the toe was too easy here, we changed to one with more resistance until we met this Borg scale of 4 to 5. So in this study we did both mobility exercise and strength exercise. We will go through most of these. What do you call one of those? Do you call them exercise? What do you call them? Exercise. And the whole program is also exercise. Yeah. So in IBM, as I told you, it's more common that you have mobility problems due to the muscle weakness. So mobility is important in this study.
Another question.
Yeah, sure.
So in the IBM, it's more the dexterity is lost, but it's more
I would say. Did you hear the question?
No.
No? So the question were, is it more the dexterity in IBM that is effective, but
grip strength
in dermatomyositis?
But with dermatomyositis, you can also have dexterity loss instead of the grip strength.
That is my clinical opinion.
Okay.
It is. So I have my patients do the, what's it called, the Perjury paperboard. It's the ones who were in New Orleans, you did that, I think. You're supposed to put a lot of pegs. You have 30 seconds to put as many pins as you can. And we could see quite clearly that also all in dermatomyositis difficulties with the dexterity. Not as much as the IBM, but still.
As an IBM patient, I would tell you that it's strength and the dexterity.
Yeah.
I've done exercises for both of these issues, but I almost feel like it's more the strength that I'm concerned about. Dexterity is a little bit hard because of the finger flexors, but that contributes to the overall strength.
Because I guess the problem with IBM is when the finger flexors are getting too weak that you can't flex the joints at the end. So
like that.
So you get, yeah, or you get, you get. area. I haven't seen it, fortunately, that much in the studies that I've done. It could be, for me as a researcher, to be better to do better studies. And I was thinking also, because I'm a colleague to Helen Alexanderson, and she's like doing multiple exercise studies. And I thought, wow, why haven't I done several? I mean, I could do the hand exercise. I was like, well, I've done the hand exercise, so let's move on and do workability, which I also have done. But we need to do more to know. Sure.
I do multiple hand exercises. How much is too much?
Well, that's not an easy question to answer.
How do I know if I'm overdoing?
I would say that if you get more pain, so usually we say if you get pain more than 2 hours after you have been exercising or getting, then you have done too much. I think so. I think it's okay. If you think it's okay to be 80, of course it's okay. But not too long period. And there are also subsets of myositis that have arthritis. And that is also another issue. If you have joint inflammation, you need to think about that as well.
Thank you. You're talking about the exercises and you're talking about your studies in a 12-week period. Have you followed any of the people with the exercises for a longer period of time?
I have not.
Do you plan on doing it?
I think I would.
It was one of the things this morning. I heard Dr. Lloyd's presentation on myositis, and he was showing a chart, and it showed a 6-month chart on various things, and saying that he was going to go towards 2 years. So I just wanted to know if maybe you were planning on doing something similar.
I am now.
She's great.
But I mean, it also depends on the participants that are actively doing the hand exercise. They can continue doing it, and they need to continue with the measures. I mean, it's not only me, it's all the ones that need to volunteer to do this. I mean, that is also a key. So, during the method that I did in the hand exercise study, it's called single subject design. And these are the measures that we did before, the ones that are supposed to be each person's control values. And if we take like the mean value of these and you add two standard deviations, really know or need to understand, but if you pass the 2 standard deviation line, more than 2 after each other measures, you will have a clinically important improvement. And I thought, again, the researcher isn't smart yet, but she's trying. I thought that the hand strength would be kind of the same, that it wouldn't fluctuate so much. I was wrong. It fluctuated a lot in those patients or the participants that I had in my study, which made this 2 standard deviation band quite broad, which made it difficult for me or them to get an increase. So what I need to do is do more of these measures before I start to do the exercise. This is a methodology problem that I experience. But this is the one participant, number 6. It improved, or we call it hen, like her, or you say hen as well, maybe? Yeah. It's not a chicken, it's so the key pinch, which is this grip that you put your thumb on your index finger middle joint, the left hand, and again the 3-jaw pinch, which I explained before was this 3, was improved. The right hand. So, I learned a lot, and I can do better.
Why do you choose left hand to right?
So these were the ones that I could see a change, or I could see an improvement. The other ones were too wide of this 2 standard deviation band, and it didn't exceed the line. So this is why I show this one, because these are one of those that actually improve. Yeah, sure.
So with the pinch grip, and that is really something that I have a very difficult time with. And so there's specific exercises that should help remove my pinch. Yes. I'm looking for those.
Yeah, they're coming. They're coming. So what we saw was that it was few improvements, but that regarding the hand function and the grip strength and pinch grip strength, but no one that works. So it's not fun to hear, but maintaining is also maybe a positive result of this study. And there is some space for improvement, I'm sorry to say. The participants were also asked to name activities that they wanted to improve that had to do with their hands. As I am an occupational therapist, this was interesting to me. And here we can see change. We couldn't see so much in the grip strength or the muscle strength, but we could see that 6 of 9 participants improved in their performance or their satisfaction. So the question is how, so the name, a lot of different activities that you want to improve, and then you choose 5. I don't know if you have done this at your OT department. And then you rate on a 10 scale on your performance and how satisfied you are with the way you're doing it. So 6 of 9 improved in activity, even though that the hand strength did not, according to my method. It might have been if I'd done a better study. So it's not bad to also include activity in your training, because you want to improve the function of your hand, I guess, for particular activities that you do. So I would say for both poly and dermatomyositis, it's important to do, so this is for all, I would say. I think it's important to do both mobility exercise and strength exercise. Maybe more for the inclusion body myositis, but still, it's good to check that your fingers are still working and that the joints can still be flexed. And in inclusion body myositis, I think it's also important to do it passively, so if you can't by yourself, use the other hand and then try it. So but if you have arthritis, then you shouldn't rest. But if you don't, it's okay. Maybe I can.
Yes.
I'm new at this last 9 or 10 months that I came up with, or I was given the diagnosis of IBM, and I'm listening to all this and thinking, gee, am I unusual? Because all this strength I have left in my hands is my thumb and first finger. I have pretty much normal strength there. The 3rd, 4th, and 5th fingers on both hands are useless, but I'm hanging on by thumb and first fingers. Is that an unusual combination?
So you're normal like everyone else.
If we do these exercises, then we will get these back again?
Well, I will tell you what I think. I will tell you what I think. Because I have the mic, so I can tell you exactly what I want to. So, remember that I was an eager PhD student wanting to add every single exercise that you can think of. A little bit older, a wiser, I think you should focus on those grips that you use in your daily life. And I guess you have a busy schedule with all the doctor's appointments. You should go to the physio, and you should walk, and you should exercise, and you should take care of, I don't know, kids and grandkids. I mean, you have busy lives. So I would make less exercises more often and focus on the things, the grips that you use in most of your daily activities. And those are the ones that I will show you today, which I would suggest. And if you think it's too easy, I mean, there are plenty of ways to exercise. But again, it needs to be feasible. You're not supposed to sit like an hour every day and do hand exercise. You can have more important things to do. I thought we maybe do this together, right? We have time, it's half an hour. If there is a possibility to put your arms on the table or on your chair, and what we do here is that we, you see, lift your wrist as much as you can, and then relax. So sometimes it's a little bit hard, so maybe you can put your other arm around under your arm and lift it up because it gets a little bit less tense. And maybe 5 times for each hand. So this is a way, this is the mobility exercise. So this isn't really for strength. Yeah. And then you do exercise. When you do it with a weight, you will exercise those muscles that are on your extension muscles. I will go, I remind me if I forget. We'll come back, I think. We are also, this is the wrist. We're going to flex all the fingers. But we're first going to start to flex only the 2 joints that we have distally. So the 2 first. So try to just flex those. If you're coordinated, you can do both hands. If you're not, take one hand at a time. It can also be good to just take one hand at a time because then you can relax. You get some relaxation. And the reason why we do this is if we say make a fist, it's much easier to just up with your thumb and you don't get all the joints. Yeah. He's coming. You get the exercise.
I can be loud. 2 years ago when I was in one of these sessions with Helena, we were able to talk about exercise, and exercise was the sort of subcategory. She suggested to help your hand along in the force of the exercise. So of course I can't and those finger flexors,
but if you take the other hand, yeah, that's totally fine. As long as you don't have joint inflammation. As far as you know, you don't have.
If you have joint inflammation, what should you do?
I don't think you should press with the other hand, but you can do it by yourself. Actively. Even though it hurts, it doesn't matter. Well, it does, of course, because it hurts, but it's not dangerous. Yeah. So I meet in the clinic. I also meet the patients that have rheumatoid arthritis, and they have inflammation, and that is. So then we go over to that regime if you have arthritis. So even if it hurts, it's not dangerous. Or you can't hurt yourself. So the next one is that you flex the other 2, that is on the base and the second one. So you try to reach with your finger as far down on your palm as you can. This is kind of like you when you're waving. In Sweden we had a woman, I don't remember, it was a TV show and she was doing it backwards. Everybody knows her. Sweden. It doesn't work here though. This is also the pump. So if you are swollen in your hands because of inactivity, you can do it. So if you have had a fracture, this is what they say. Get the blood pumping back. So these two ends up in the third, is to make a fist. There you can help with the hand. I've seen patients using the table. That is also possible. As long as you try to flex all the fingers as much as you can. So for IBM, very important for the exercise, for the polydermatomyositis, check it out to see that the fingers are still working. Maybe once a week. Very
Most everybody seems to have trouble as they expand bending their fingers. I can't straighten mine. Is that unusual?
What do you say?
Straightening it straight.
I can't straighten.
Yeah. I don't know. Nobody has. Because you then I guess if you don't have a strong as long as you don't bend it backwards, because that is
Someone from outside watching us, thinking, what's going on in this room?
again. No, but I think it's going to be on the website. Yeah, I hope so. I will make sure it is. So you don't have to take any, and I think the hand exercise program is on the GMA. Since before. But I would definitely make sure that you get it.
Which one?
So you don't have to save your pictures for sightseeing. So we have done the wrist, we have done the finger 6 times with the thumb. So we make circles with the thumb and the index finger, and then you go through to the next. And try to make them as round as possible. So speed isn't important, it's more important to make them round. So you're not supposed to do like that because that is not possible. Try to make them round. Well, I will take that later on. And then we have the thumb. So you push the thumb as far up in the roof as you can, and then a wide circle, as if you would pick up a big jar. A beer, yeah. So Oktoberfest, they have really big glasses. So, and then down to the pinky finger, base of your little finger, and then up again. So a big circle. So that is the range of motion that you're and you can reach the fingers while you do the circles. Well, I have some dough and I have a bowl. But I only have like 5. Can you try them all? You want me to? I can share them?
Yeah.
Yes, it is. So maybe I'll just. Yes. Yeah. Amazon?
Is the dough better than the ball?
Yeah. So that's fine. Anything. So again, as we were thinking about with the study that we did is that if you do the full program, on a scale from 0 to 10, you should be on a level of 5 of exertion. So it shouldn't be too easy, it shouldn't be too hard. And whatever works for you is fine. Well, it's called therapeutic. So I think it's a silicone-based exercise though. So yeah. Yeah, exactly. So the color is different in different brands. Sure, it is. And I think this one that you got here, if you would just put it on the table, so please don't do that, it would just float out.
Yes, it does.
It does. So, and if you do the exercise fast, it will give more resistance than if you do it slowly. So that is also a thing with the dough. But as you said, you can use a sponge or something. What is important when you choose is that you can flex the fingers, so it's not too hard that you can't flex it. So you don't want the fingers to go backwards because that is not, or the joints going, the position is not supposed to do. So this is more hard maybe for all of you to do, but you can kind of pretend that you have a ball or a dough in your hand. So it's kind of the same as we have done before. So we make a fist, we squeeze the ball or the dough with all the fingers. And yeah, pass the dough around if you want to try it out. 10 to 15 times. And the next one is that you do circles again, but through the dough or the ball. This is a little bit more difficult for you because you're not as strong in these muscles when you take one finger at a time. Then you can do it less times. Here it is very important that you are flexing all the joints, so you don't end up doing the joints in the backwards, because it's very easy to do that if it's too hard for you. What I also wanted to say is that so we are weaker normally in these fingers than we are in those three that we usually use. And I think my thinking is that it's better to exercise with those that you use. So even though that you're not really strong, tell me if I'm wrong. If you're not as strong as you maybe have been in those fingers, it might not be as important as if you're. You understand? So it's okay. If you agree, it's okay to not be as strong here as you are in those. So I think this is important. I mean, you pull up your hands or you feel your buttons and you use this grip a lot. This is what you exercise here. You use also this grip because this is where you're strong usually. That is the strong grip as you have in your hand. So this is the key. And you can either do it by the ball like that and then you exercise both fingers at the same time. Otherwise you just put the ball between the thumb and the index finger and you press. This is one of the most important, the most commonly used grips that you use in your daily life.
Buttons up there.
This is the 3-pinch jaw that I was talking about. So you press the thumb with the ball or the jaw between and press. Are they familiar? Do you recognize them? No questions? No, you're all quiet. I'm a little bit worried.
The question back here, it's okay. Do you have a preference for the dough or the ball?
No, I have the preference. I think it's kind of like my dentist said. I was asking her which toothpaste I would use, and she said I usually take it white because you don't see the stain as much as with a glue. So I would say the one that you feel comfortable using. So if you think it's icky and sticky with dough, use a ball. The ball is usually more. It's more resistance usually in the ball, and it could be more difficult to use. So having both what you like and what you would prefer, and also how much strength you have and what you can use. The thing with the ball is that it also gives you can hold. You can have what do you call it? Not only the dynamic exercise, you can also keep the strength in the position, and that you cannot do with the dog. So
started using a jar opener.
I would say if you're strong enough to otherwise make it over.
They're all this, most of them are the same.
But I also have patients
Looks like a
that
big
want
wedge.
to have it over.
Yeah, that's the one I have, an orange triangle.
Mine's
I mean, I'm not saying that it's right or wrong. Whichever you
You could buy electric jar openers where you just put the jar open, it automatically starts the motor and it unscrews it for you.
That's nice.
I don't know if, but I've seen it, yeah. Amazon is everything, so.
Yes, Amazon.
To get the simple
Because.
accurate, going through the exercise program, doesn't seem any benefit from it. My question, what's your opinion of the hot wax band?
So, have not done a study on the hot bath, and what we have seen for in arthritis when you have like the joint swollenness, and so the wax bath gives you warmth, and if you have pain, you get less pain, and that is in arthritis you can see that those who had the wax bath got better results on the hand exercise, but that was probably due to less pain. So the warm bath is just for now, for the moment. It doesn't have a longitudinal effect. It's just so. I'm not sure. Do you think it's better too? Do you think you have benefits of using? No. Yeah. Yeah, it does. And maybe you get relaxed and you warm up your muscles. I mean, it could be a way to get your hands started, but there's no study saying that it's good or bad either.
When you bring that up, I was going to bring that up later. My OT actually gave me the paraffin wax. You stick your fingers in it to get it warm, and then he had to stick my whole hand in it, and wax over my whole hand. And he wrapped it in a warm towel for about 10-15 minutes. And then when I peeled the wax off, it was only on the hand that was the weakest. And I was able to grip. And then we did an exercise with my hand. I was able to grip and do a little bit more exercise after he did the wax treatment. So it helped a little bit. He told me where I could go buy it because they said they use it in nail salons.
Yeah, exactly.
I was like, I saw where I could get it, and I started to buy it for that reason. But it did have a benefit for me.
Now I have a suggestion for 2 studies. So exercise for a longer time than 12 weeks. And maybe add the wax bath.
I'm not quite sure if all that was getting a little bit, told by neuromuscular specialist and a physiatrist that, forget any of this no pain, no gain stuff. If any sign of it bothering you, stop. Do it to that point. Be repetitious, and when it gets there, stop and get there again.
So I would say if you do the mobility exercise and it hurts, it's okay. But I would say if you have pain longer than 2 hours after you have been doing the exercise, you have done too much. So next time do a little bit less. But yeah, the muscle weight, yeah. So you need to have both exercise and then also recover. running through some kind of lake. It hurts. I will tell you.
For anybody looking for the putty, Amazon has a 4-pack of different strengths of putty for $13.89.
Okay, hi.
You can share it, find it together to see which color you want. Yeah.
I was having difficulty at home and again here doing the exercises with the ball within just one hand. The only way I could accomplish the use of the muscles was if I rested the ball on the table or held it with the other hand.
Yeah.
Is that
That is
okay?
okay.
Okay, that's supported. Okay.
So, but if you try to make your muscle exercise and you use the other hand, you will not get any exercise. But depending on, I mean, you can hold your arms, you can have it like that, or resting on the table.
There is a device called a power whip flex grip that comes in 3 different
Oh, is it like the one that you put
through. You can buy it on Amazon, and if you live in the Twin Cities, there's a store called OPTP in Plymouth. They have all sorts of toys, but it's fabulous. I have 2 of them, and so you get to grip and then stretch.
so they do both extension and then, well, I will do that afterwards. I would love to. So I mean, there are many different ways to exercise the hand. So I think the important thing is that you can flex the fingers and that it's enough resistance. So it's not too easy for you. So you only actually, I think, have one left, which is to, it's kind of the same movements that we did for the mobility exercise. So what you do is that you put the ball on the dough. No one is using this. So what you would do is that you press the thumb, sorry, you don't have that thumb, towards the base of your middle finger. Then you will also get the thumb exercise. It's okay if the joint is straight, as long as you get that. Otherwise, to conclude, I would say it's safe to do exercise. How many of you do hand exercise? Have you all been doing? Is it hard to keep up?
Yes.
Or is it? No? Do it? Good. We have seen some individual improvements. No one has gotten worse, which is also positive, I think. Maybe have some activity training, because you usually get better on what you like. If you exercise the thing you like to do better on.
So just 2 quick comments. Be careful of the money you buy on Amazon. I bought some on Amazon and they were silver. So those, I find it very difficult to. What you had was very dry and easy to manipulate. So I went to my PT and found what brand he was using, so I would do the same thing.
I tried to
You got familiar about it, you can do too
my
much.
phone can't reach it.
When I first went into
Check the electric
first got diagnosed, I squeezed putty all day long. Right? And every PT I went, if you guys have been to PT, you remember, the mantra is, okay, they give me an exercise and go 3 sets of 30. Right? Every 3 sets, so I was doing 3 sets of 30 of these a few times a day. And the OT looked at me like, it's like sugar head. Stop. So there is you might want to do 2 sets, 20 like morning and night or something, but think there is too much, I think
Yeah.
everywhere.
So I think maybe 5 times. I mean, there is again, you need to continue doing it. So if it takes too much time and you can't really think it's, I mean, if it's not funny, I mean, you need to have joy in your life as well. So I would say maybe once a day, 5 times a week, 2 times a day, but maybe not more. And then 10 to 15 in a good resistance. And if there are any, I mean, I would suggest you to visit an OT that should help you just get started. Or it's better. So this is the new hospital that is cost lots of money. People are getting fired because they bring out their trends. So this is the new Karolinska University. I guess you have much more nice hospitals in the US. We have just